When it comes to breast cancer, it is no secret that early detection is key. And here to tell us why that fact is so crucial is Dr. Elizabeth Arguelles with 21st Oncology. Good morning.
Good morning.
Welcome. Welcome to Southwest Florida, I should say, as well.
Thank you.
You're new to the area. And I love just kind of chatting with you beforehand with how passionate you are about educating women, educating families. And that's what we're doing this morning. And let's talk about why early detection. I mean, I think people have heard that before. But why is that so important, certainly in this day and age?
Well, the cure rate for breast cancer has improved so much over the years. The earlier you find the cancer, the smaller it will be, the less chance that it's spread anywhere else. So if you can find it at that early stage, your cure rate is going to be nearly 100%.
Wow, that's awesome news. All right, so let's talk about how women can actually figure out and do their, number one, annual mammograms. When should these be done? How important are these? Who should be getting them?
Okay, so personally, if you have breasts, you should be getting them.
Okay.
Okay, and a lot of people have questions about when to even stop. You only stop if you're not going to do anything if you find the cancer. Okay, as long as you're going to treat it, you should have one.
Okay.
When should you start? Really at 40. I know there's been a lot of controversy, a lot of different things have been said in the media recently, but the American College of Radiology, the American Society of Breast Surgeons, me personally, we all feel that you should start at 40 and have a mammogram annually. If you have a family history of breast cancer or ovarian cancer or any other kind of cancer, it may be relevant. You may need to start screening earlier. Sometimes with certain genetic diseases, we start at the age of 25.
Oh, wow.
So you should always mention any kind of family history of cancer to your doctor.
And that's what I was going to ask. Who do you talk? Just your general practitioner, your OBGYN? Who is going to be the best person to have this conversation with?
Really, either is fine. You know, if you don't, it's a lot of young women do not have a general practitioner. They only have their OBGYN.
Okay.
So that's totally fine. If you ever feel that you have a large amount of family history and your doctor's maybe not doing what you think they should be doing, or your sister or your mother had more screening and you're wondering why you're having less, you certainly can always request, hey, can I see a breast surgeon like myself? I see patients who have strong family history all the time. Sometimes we recommend them for earlier screening. Sometimes we don't because it's not appropriate. But we can do different risk models to help figure that out.
Now, when you say family history, is it, I mean, you kind of touched on this, but it's not just breast, I mean, it's any kind of cancer, male or female, in your background that needs to be brought up and a conversation needs to be had.
Mother's side, father's side, all the way back, grandparents, great-grandparents, nieces, nephews, children. A lot of times, you know, we'll have an elderly patient and we'll find out that their daughter and their granddaughter had breast cancer. Okay, so that can still increase their risk. It's not just breast, it's ovarian, colon, pancreatic, stomach, melanomas. Okay. And the thing that we're most concerned with is people who are getting cancer at an early age, especially before menopause. Okay. That'll increase your risk much more. I was just going to ask
what early age is.
Yes.
Talk about the importance of a self-exam. And, you know, it's funny, we were talking about this as ladies, and sometimes I feel, you know, like, oh, I'm not going to know what I'm looking for. I think maybe that's why a lot of women just don't feel it's important to do it. Will you know if you're giving yourself an exam?
Yes.
Okay.
And listen, nobody's perfect. I'm not perfect. I don't do it every month. You shouldn't quote me on that, but it's true. Occasionally, usually the best time is the week after you've had your period. Your breasts will be the least dense then. You'll be able to feel them. You can feel them in the shower. You can feel them in the bed. If you don't want to do it, you're
significant other.
Yes,
I love that you say, hey,
significant other, your partner, anyone can do it. That's fine as long as you give them permission. Yes. But just have someone do it regularly.
Just do it. So as we kind of wrap up, we have a little less than 30 seconds, Doctor. What is your take home? What do you want women is, you know, this is so crucial as we have a lot of women, a lot of families watching this morning, maybe even some fellas who can encourage, you know, their partners to take this seriously.
And men too. If men feel a lump, male breast cancer happens.
It does.
Rarely, but it does.
Yeah.
Yeah, absolutely. If you feel anything, definitely tell your doctor. Don't be afraid to check. And please don't be afraid to get a mammogram. It's so important. They really do save lives.
Well, again, welcome to Southwest Florida. We're so
much.
excited that you're now part of the medical community here in Southwest Florida, and I hope we save some people some trouble and they get this done, have the conversation. So thank you so much, Doctor. And of course, for more information, just head to our website, fox4morningblend.com.
Florida is known for a lot of things, but did you know that burrowing owls is one of them? Up next, we take you to the 14th annual Burrowing Owl Festival and introduce you to our next guest, who is a real hoot.